Hi, welcome back to the New England School of Homeopathy Countdown. It's nice to be with you again. This week we are going to send you another paper case. It's a case of mine of a little girl that had all kinds of problems, and I'm going to let you read about that on your own. But the reason that we chose this case is because it is a very common thing in our day and age to see kids that have kinds of psychiatric conditions, everything from attention deficit disorder to oppositional defiant disorder to conduct disorder, all kinds of issues with anxiety, depression, self-harm. And in our practice, we've been in practice now, many decades, we both feel that these kind of conditions are really on the rise for many different reasons. We could talk about why that's the case. But the beauty of homeopathy is that it is a natural and gentle medicine that can work with children and families that have problems like that. So this case will illustrate that. And just one point about the case: if you're somebody who is very familiar with cycles and segments, just start right out with the case. If you're less familiar with it, bump down to the last page or so where I do another sort of basic overview of cycles and segments, so that you'll be more prepared to read the case and understand how we work with the symptoms and the rubrics and the case analysis that we do in this particular case. One of the other things I want to underscore about this case, and we will talk about this further at another time, but one of the things I wanted to underscore was the idea that besides homeopathy, once we find the remedy for a patient and once we understand what the remedy should do, I like to write those things down, what I expect the remedy to do. First of all, it helps me a lot at the follow-up visit to know what it was that I was wanting the remedy to do. And also, I use it as a little bit of encouragement to the parents. This is what we want to see. And I think it can help in that way to be very direct. I write it down for me. I write it down for the parents. I have the children hear it if they're old enough to hear it. And that, I think, can be very helpful. You'll also read about, in this particular case, some recommendations that I had for the parents around parenting and around things that they could ask and expect of the child based on her age and capacity to do and contribute in the family, and that to hold children to high expectations is an important part of the whole, treating the whole person and treating the whole family. And a lot of our students will ask, how do you work with children like that if you feel that maybe the parents were part of the problem? Well, we can't legislate it, but we do like to treat the whole family when possible. We get our best results when we can treat mom and dad or whoever is around in the home raising the child. And sometimes treating siblings as well can be very, very helpful. The particular remedy that's used for this child is not a remedy that we commonly give in kids, which is why I also liked writing up this case, thinking about it, and kind of going back and reviewing why and how I got to the remedy that was ultimately very effective for the child or for the family. So we hope that you'll enjoy reading the case and get a lot out of it. And we will come back to you and talk more about some of the particulars the next time that we meet. We are now in the middle of deep summer here in New England, and you probably can hear some birds in the background. We've had a lot of rain, which is making everything incredibly green and beautiful, though I think it's a little rough on the farmers. And we are really looking forward to meeting some of you at the next opportunity that we have to study and read and think and talk about homeopathy. Be well.